SkinShine, it's your girl Winshine from Eternal SkinShine. Today we have Lauren with us. We're going to be doing MORPHEUS8. MORPHEUS8 is a radiofrequency microneedling procedure, and what that does is that basically remodels your skin from the inside out. So we use radiofrequent thermal currency to basically cause injury to your dermis, which is, your deep skin layer, and that causes you to create new collagen. And with the new collagen, it's going to plump up your skin, it's going to make your skin smoother. It helps with wrinkles, skin sag, it helps with scarring, whether it's acne scarring or some kind of scarring from an injury, and it really lifts and tones, and people look at you and they're like, you look better. We don't know what it is, but you look good. So we're gonna start by numbing her first. Ready, Lauren?
Yeah.
Okay.
Some contraindications to be aware of is you want to make sure that your patient isn't pregnant or nursing. You want to make sure they don't have any type of electronic or metallic implants anywhere in the body, as in a pacemaker or an internal defibrillator. Be aware of any metal plates, screws, piercings that are near the area to be treated. And in terms of injectables, if the patient has been treated with any neurotoxins like Botox within the last week, then you want to wait, make sure that it's completely healed before you treat them. In terms of fillers, we usually like to wait 3 to 6 months after filler placement. If the filler was placed very deeply in the periosteal plane, meaning close to the bone, then it can be treated earlier, perhaps 1 to 3 weeks, depending on healing. We also want to make sure the patient doesn't have a history of skin cancer or any pre-malignant moles. I want to make sure that they don't have any impaired immune system or immunosuppressive diseases like AIDS, HIV. I want to make sure they don't have a history of diseases that are stimulated by heat, as in herpes simplex. If they do, they can be treated with a prophylactic regimen a few days before the procedure. We want to make sure that they do not have any poorly controlled endocrine disorders such as diabetes or any thyroid dysfunctions, hormone dysfunctions. We want to make sure they don't have any active skin conditions like sores, rashes, eczema, psoriasis. We want to make sure they don't have any abnormal wound healing like keloids or just very dry, fragile skin. We want to make sure that they don't have any issues with bleeding in terms of having a hard time coagulating or healing from bleeding. We want to make sure they haven't had any facial surgery within the last year. We want to make sure that they don't have any facial dermabrasion or resurfacing or chemical peeling that's been done in the last 3 months. And we want to make sure that if they have received any kind of laser, light, RF treatment in the area recently, that we wait a full 2 to 3 weeks from the procedure and make sure everything is properly healed before we work on the MORPHEUS8. We want to make sure if they have been using Accutane that they wait a full 6 months after the end of the treatment to begin MORPHEUS8. Also, some things to really consider for pre-treatment instructions: we want to make sure the patient isn't exposed to sun, isn't exposed to any active tanning for 3 weeks prior, and we say 3 weeks after, just to make sure they don't get any post-inflammatory hyperpigmentation. We want to make sure that they discontinue any irritants 2 to 3 days prior to treatment. And this meaning any glycolic acids, salicylic acids, or retinoic acids in their skincare regimen. We want to make sure that the patient refrains from taking these medications for a week before the procedure to minimize bruising and swelling. Aspirins, NSAIDs like Motrin, Advil, ibuprofen, these can cause more bruising in the area, causing them to swell more as a result of thinning the blood. Some other vitamins and herbal agents that might cause this are ginseng, ginger, ginkgo biloba, garlic, kava, celery root, fish oils, St. John's wort, licorice. So just make sure you let the provider know if you have any of these that you are using currently. Also, really good to stop alcohol consumption 2 to 3 days prior to the procedure, just to also minimize bleeding that can cause more bruising and swelling in the area. We also want to make sure the patient arrives with very clean skin, so making sure no lotions, makeup, perfumes, powders, oils are present on the skin still, and that they've thoroughly washed their skin.
All right, so we just finished our Morpheus procedure. As you can see, Lauren's face is a little bit red, it's a little bit swollen, and that's totally what we expect. We want that because we're causing injury to the dermal layers, right? And that's what's going to cause her to create new collagen. And so she's going to feel really, really hot, right? Is that what you feel? Your face?
Swollen and
hot, exactly. Yeah. And some people will want to put something cold on their face right afterwards, but remember, we used heat conduction to create this injury. So try to refrain from doing that if you can, and that'll cause you to create more collagen, okay? It's kind of likened to if you go to the gym and you work out, you're kind of injuring your muscles so that your muscles repair itself and it grows larger. So that's what we're trying to do here, but we're doing it with collagen instead on your skin. So go ahead and take a look at yourself. So you can see, like, you're a little bit red, you're a little bit swollen. That should go down the swelling should go down a lot in the next few hours. But give it, a few more days. You can start to see some cresting, see some peeling even within the week. And that's all totally normal course of healing through this, okay? But the redness and the swelling, that should go down within hours. You'll see like a significant difference, and then obviously, within days, you'll see even more difference in terms of that. We also did Lauren's eyes, and as you can see, they are a little pink and swollen, but there's no bruising. But I just want to bring up that can also be a possibility because there's a lot of vessels around the eyes, and luckily we didn't hit any today, but sometimes we can hit some vessels and we can cause some bruising around there. So that can also be a possible outcome. But that should also heal with time too. In terms of post-treatment care, we want to make sure that you keep your face really clean, okay? So I put some nectar on her right now, this Elastin Regenerating Skin Nectar. I'm a huge fan. It's got the Trihex technology. It helps take away your old elastin collagen debris, and it allows your body to make room to build new elastin and collagen, which is what this whole procedure is about anyway. So it just really helps augment all our results and get better results quicker, faster, and the healing time is cut down by a lot. So I put that all over her face right now. We can also put a little bit of balm over it as a protective layer for the first 2 days or so. But really, we want to keep the elastin nectar going on for 2 weeks after the procedure to help with the healing and to help augment that collagen growth. And we don't want to use any makeup, for at least the first 24 hours. If you can stand for 48 hours, that's the best. Try not to put anything on or around the face. So, if we're still, masking, then try not to, try to avoid wearing a mask during this time if you're working from home, or if you can do it on a day off, that'd be best. Try to sleep with your head elevated on a clean pillow. So wash your sheets, and then try not to sleep on your side of your face, or definitely not on your face. I myself am a stomach sleeper, so I totally get it, but try as much as you can. Keep your face really clean. Definitely sunscreen. We're going to be doing sunscreen now. You guys should be doing sunscreen for now until the rest of your life, because that is the cause of 90% of our aging comes from sun's rays. But this period is extremely, extremely important. For the first day, I'd like to say, try not to put too much on the face besides the nectar and the balm. So maybe wearing a big floppy hat, trying to just, be indoors the whole time. But if you need to be in the sun, put sunscreen on, and then thereafter, definitely highly recommend sunscreen, wide brim hat, visor, whatever you need to, staying indoors, being in the shade, all of that stuff. But that's pretty much it. The healing process is really just allowing your body to do its own work and to heal and repair and then create nice collagen-filled skin for you. How do you feel, Lauren? How was that for you?
It was intense in moments, but I'm really excited to see the effects that my skin's gonna go through. And I'm excited also to plan out for my next appointment.
Yeah, awesome.
Yeah.
So in terms of appointments, you know, we usually say you want to start with a package of 3 to begin with, because you want to augment that damage, you know, 4 to 6 weeks apart, and that's going to give you the best results. So after the first one, this is 6 weeks later, we're doing the second one, and then it should be 6 weeks later, or 4 to 6 weeks later for the next one. Start with the 3, see how we do. You know, sometimes 3 is not the magic number for you. Sometimes it's 4 or 5, you know, but sometimes, you know, people see results quicker than that. It depends. What you're going to see immediately is you're going to see immediate plumping of the skin. Like right now, you obviously see some swelling, and then tomorrow and the day after, you're going to see immediate plumping, immediate like more smoothness, and that's really your body reacting to what's happened to it, and it's just having an inflammatory response and also having like immediate response. So the actual collagen growth, that is going to happen later on. Give it weeks, months out even, and that's when you're going to start to see the collagen build compiling. So super excited to see the results too. Stay tuned, Skin Studs, and let's be together in this journey for beautiful skincare.